What a healthy sugar level in your blood is. Let's come to the diabetic range. What happens in a diabetic person? Namaste, this is Dr.Samarth P. I'm practicing at Amrita Ayurvedic Center in Baswangudi. Today, we are going to pick up a topic which is very common and rampant in India. It's called diabetes. In Ayurveda, we can categorize it under prameha or madhumeha. So you are an individual, you are asked to take a blood report as part of your work, and you have a highlighted number in your report. Let us try to understand what this report says. Nowadays, the reports gives you a heads up about what your health condition is. Don't panic about it. There are different ways to work around it to reduce those numbers. Ayurveda is a very clinical, symptom-based system of medicine where proper symptoms and those symptoms are treated looking at the root cause. There are also pre-symptoms. We call this Purva Rupa. In a disease, there is a Rupa, symptoms. There is a Purva Rupa. Are symptoms, the pre-symptoms that come before symptoms. So let's look at diabetes. What are those numbers? What do they say? Let's talk about what a healthy sugar level in your blood is. There are 3 times you'll have to check your sugar. When you wake up early in the morning, when you have fasted well for say 12 hours, you have to check your fasting levels. So that you have not eaten anything, you have slept well, you have waken up, you have fasted, you have not even had your coffee and tea. You can drink water, but without consuming anything, you have to check your blood sugar levels. The normal range of fasting blood sugar is 70 to 100. So 70 to 100 is what is considered as normal in a fasting stage. Now, you consume your food. Say after you consume your food, there is a spike in your sugar. So what's an acceptable normal range of spike in sugar is between 170 to 200. So you did your fasting test, then you went and had food, then you check your levels, it's roughly 170 to 200. This is normal. Now, after 2 to 3 hours of eating your food, if you check your blood sugar, if you are going to be normal, it has to come down to 120 to 140. So, your sugar levels are low, you consume food, it increases, then 2 to 3 hours it comes down to a cruising range of 120 to 140. This is in normal people. If you see these numbers, you are non-diabetic, you are very healthy. Now, let's come to the diabetic range. When is it that you are called diabetic? When your fasting is above 170, okay, that is when you can be considered as having diabetes. But the general right levels is above 126. 126 is the number on fasting. You have fasted for 10 hours, 12 hours early in the morning and you check your blood sugar, it's above 126. You considered you are having diabetes. Now, after eating food, your sugar spikes to 230 to 300. This is in a diabetic patient. These numbers are in a diabetic patient. And after 2 to 3 hours, if your sugar level maintains above 200, that is also a diabetic situation. So very clearly I have given you a demarcation between what is normal numbers, your non-diabetic, and what is diabetic. Now, there are gold standards. HbA1c or A1c, it's a 3 months average, gold standard. Generally says, if you are less than 5.7%, you are non-diabetic. If you are between 5.7 to 6.4, you are not having good control on your sugar levels. Above 6.4%, you are considered as being diabetic. These are the standard numbers. So when you driving a vehicle, you see a stop sign that's red, you see a yellow sign, get ready, you say a green sign, go ahead. Similarly, a green sign is a normal, red sign is diabetic, and the numbers that are in between, it is a wake-up call for you that you have to do steps to reduce that extra amount of sugar accumulation in your blood, or in type 2 diabetes, to help you absorb all those sugar levels, sugar in your blood properly in your body, and your body cells don't show a resistance. Example, what happens in a diabetic person? What happens in a normal person? You consume a idli. Idli has rice in it, it has urad dal in it, you consume with chutney. When you consume it, it gets processed. There's glucose that circulates in your blood. There's also insulin that's produced because of it. And the cells absorb this glucose from your blood. But in a diabetic patient, what happens? When he consumes this idli, it gets changed into glucose, but it's not properly absorbed by the cells. This is in a typical type 2 diabetes patient. But in a type 1, there is problem with production of insulin. Insulin is the key for the cells to accept all that glucose that's circulating in your blood. So this episode, briefly, I have talked to you about all the numbers, the normal levels and the abnormal levels, and being diagnosed as diabetes, and giving you a brief description about what prameha is. So next episode, I'm going to tell you about certain things to improve your diet and lifestyle so that you can control your sugar levels properly. Thank you.